also want to just give a special thanks to Brandon Hamdorf, Kim Koslow, Holly Leeson, Jackie Scafidi, and Victoria Hauser for leading the charge of this open house, as well as our entire outreach team and entire Orenda staff. Again, you will hear from many of them today. We're truly blessed here at Futures Recovery Healthcare. Our motto is multiple pathways to recovery, and we're blessed to have 4 wonderful programs. Our core program to treat primary substance use disorder and co-occurring mental health conditions, our primary mental health program, our adventure-based program in RISE, and what we're here to talk about today, which is Orenda, our concierge program on our 3rd floor. So today, we're excited to be able to celebrate our 2nd anniversary for Orenda. We opened in spring 2019, and we truly have done remarkable things and helped many people and families in this wonderful program. So today, I want to kick it off to the wonderful people who make that happen on a day-to-day basis, and thank you again for your time. So I'm going to hand it over to Deja Gilbert, our Chief Operating Officer. Thank you, Deja.
Thank you so much, Mike. For those of you who don't know me, my name is Deja Gilbert. I'm the Chief Operating Officer here at Futures, and here joining me is Angela Bustamante, our Clinical Director. Angela, say hi.
Hi, good afternoon.
And I want to first start by recognizing all of you who've taken time today to join us, and also thank those of you who've trusted Futures and the Orenda team with your own clients, friends, and referrals already. Our relationships with professionals just like you continue to support and guide our team to be what it is today. And for those of you who are here to learn more about Orenda for the first time, you may be wondering things like, what is this program? What sets it apart? What kinds of clients do we serve? And a lot of other questions. And I can assure you that if we don't answer those questions today, we are ready and able to make sure that you can come see for yourself anytime. And so just let us know after we wrap up, we'll make sure that we can get you out here. So as we celebrate our 2-year anniversary of the Orenda program, I want to share just a brief story with you that I hope helps you all understand basically what the heart of this program is and what truly makes it important. So bear with me as I get through that. About almost 3 years ago now, here at Futures, we began to recognize a population of individuals who were experiencing barriers to seeking treatment. Interestingly enough, it was this same population that most consider have the means to seek whatever kind of treatment they want. But the stigma, the need for privacy, the need for superior and individualized programming options, and the need for concierge level service for comfort was and still is incredibly limiting for them to actually seek the help they need. And so we set out to create what is now known as Orenda. We put together an amazing planning committee of individuals, most of which are still working and that you can see are here today online with us, and others that still collaborate with us regularly. And so we are very blessed that we were able to pull that team together and be able 2 years later to present that to you here. But it was a group of what I consider to be the best minds, the most diverse backgrounds, and the most opinionated professionals I've ever brought to the same table at the same time. I have to tell you, I really wish that I would have recorded that first meeting, because going into that, I was thinking either we're going to start and end right here today, or this is going to be amazing. And here we are 2 years later, and it is still amazing. Orenda itself was named by that team. And what it means is the collective power of nature's energies, believed to be present in all people and to be the force by which human potential is obtained. And that name really does tell the story of what we offer to our clients here. We have what we call the 4 pillars of care. We bring together medical care, clinical care, wellness services, and neurofocus services. And all of these pillars work together to collaborate and create the most individualized program every single client experiences. And that is what sets us apart. Yes, Futures is beautiful. We're a well-appointed facility with all the amenities you could want. But what we believe is the heart of Orenda is in the program itself and in the incredible services that we deliver to each client every single day. We are so proud to present Orenda to you today here. And now some of our team is going to go into some more detail and information about the program. And I'm going to turn it over to them to run with the show. But first, I do want to introduce you to our wonderful outreach team members who are here with us today. Kim Koslow in Florida. Kim.
Hey, everybody.
Hi, Kim. Stephen Watts in Tennessee.
Hey, folks. Glad you're here.
Thanks, Stephen. Cindy Goss in New York.
But good morning. Happy to be here today.
Thanks, Cindy. Johnny Egan in Florida.
Good afternoon. Thanks for coming, everyone.
Thanks, Johnny. Laura Coons in Florida.
Hi, everybody. Good to see you.
Good to see you, Laura. Dan Hogue in North Carolina.
Hi, everyone. Thank you for joining us.
Thanks, Dan. Holly Gleason in Pennsylvania.
Hi, everyone.
Hi, Holly. Jackie Scafidi in Pennsylvania.
Good afternoon, everybody.
Hi, Jackie. And Victoria Hauser as our Director of Marketing and Systems.
Morning. Thank you all for being here.
Hi, Victoria. And finally, last but not least, Brandon Hamdorf in Florida, who is going to introduce you through today's anniversary video. Thank you, guys.
Thank you, Deja. Hello, everyone. It is an honor to be celebrating Orenda's 2-year anniversary with such a professional and passionate group of individuals. After we provide this inside look into Orenda, you will then hear from Elizabeth Potts, our Director of Specialty Programming here at Futures Recovery Healthcare. We really hope you enjoy this video.
for introducing that wonderful video, Brandon. My name is Elizabeth Potts, and I'm the Executive Director of Specialty Programming here at Futures Recovery Healthcare. Joining me today is Siobhan Carey. She is the Executive Concierge at Orenda.
Hi, everyone.
As both Mike and Deja shared, we would not be celebrating Orenda's 2-year anniversary without the support and caring professionals and trusted leaders like you. Additionally, we would not be celebrating Orenda's 2-year anniversary without the wisdom, professionalism, and acumen that each one of our Orenda team members brings to the table. So thank you all for making this celebration possible. The last 2 years, not only Orenda, but the world has seen great change. The need for compassionate care, skill building, resilience, and hope is more critical than ever. As Orenda has evolved and we respond to this change, we have enhanced our staff and programming accordingly. In addition to the stellar team Deja referenced that launched Orenda, we have recently added a clinical supervisor, an attending physician, an additional family counselor, enhanced case management, additional training support for our ground staff, specialty providers to meet the needs of the clients we serve, and a standalone comprehensive assessment opportunity. We will continue to reflect and refine our program. In this space, we often hear the term luxury treatment bandied about. Anyone who's been to Futures knows what an exceptional facility is. Impeccable grounds, well-appointed rooms and amenities, and yet in this space, working with high network individuals, the luxury, as Deja referenced, is in the programming. It's in the deployment of individualized services based on data from assessments, client goals, and interdisciplinary team collaboration. Thank you all for making today's celebration possible. And now I'd like to turn it over to our attending physician, Dr. Karen Flannery.
Thank you, Elizabeth. Hi, I'm Dr. Karen Flannery, attending physician for Orenda, and I'm delighted to be part of this extraordinary team of professionals. My role as an attending physician here in Orenda is to oversee, design, and coordinate complex medical care for our clients. I've been working with the affluent population for many years now, and my work previously as a hospitalist led me and my heart to care for the sick and suffering alcoholic and addicted patient that is in need of compassionate and complex medical detox and services. This past year has brought on a whole new set of complexities for medical and clinical professionals alike. If ever there were a time for us to work together, that time is now. That said, I'd like to thank you all for being here to celebrate today. I'd now like to turn it over to our clinical supervisor of specialty programs, Dr. Laura Ellick.
Thank you so much, Dr. Flannery. Hi, my name is Laura Ellick. I am the clinical supervisor of specialty programs here at Futures Recovery Healthcare. Joining me today is Terry Mako, primary therapist here at Orenda.
Good afternoon.
We are really excited to be here this afternoon with everybody. It is so gratifying to see so many people who are interested in our program and looking for high quality care for themselves and for their loved ones. One of the things that usually comes up when people are talking to me about this program is why Orenda? Why should I come to your facility? Why should my family member admit to your facility? And one of the things that I like to say is we are first and foremost looking at the clinical needs of our clients and understanding that what we are dealing with addictions are complex, biological, psychological, and social disorders that often have co-occurring comorbidities like anxiety, depression, personality disorders. So what we do here at Orenda is we offer everybody a full assessment from neuropsych, from psychological, from psychiatric, because we're looking at treating not just the body, not just the mind, but looking together at the mind-body connection. We know that what happens to the body influences the mind and vice versa. And for way too long, especially in our culture, those have been divided. So we're looking to integrate and bring to the client a full treatment experience that's evidence-based and really grounded in solid different theoretical perspectives so that we know that the quality of care that we are giving our clients is based not only on science, but it's based from the perspective of clinical safety and also with first and foremost compassion in mind. So we offer our clients a variety of therapeutic approaches, including specific treatment for trauma, such as EMDR, the use of hypnotherapy. We have clinicians here who are specifically trained and are well skilled in teaching CBT skills, DBT skills. We have therapists who are trained in Gestalt. If you are looking for it, we probably have somebody here who does it. In addition, we have a very robust family program because we do know that having the families involved is one of the most important factors in continuing recovery after somebody leaves here. In addition, we've seen an increase in international clients. So we do have staff members here who do speak Spanish, and we are really working with our staff and our clinicians to really allow people to access care from no matter where they are, either in this country or internationally as well. So we're always open for questions, for comments. My door is always open. I'm always looking forward to meeting everybody in the community, answering your questions, and hopefully giving you the best experience that you and your family member could ask for. So having said that, again, I'm really happy to see everybody here, and I'd like to turn it over now to our Director of Wellness Services, Dr. Ahmed.
Thank you so much, Dr. Alec. My name is Dr. Ahmed Washwan, and I'm a doctor of physical therapy. At Futures Recovery Healthcare, my role here is the wellness director for the Orenda programming. Like Dr. Day just spoke earlier, we have 4 pillars, right? So the medical and clinical are very unique in our programming in that we take those and then we expand upon them with the wellness and the neuro aspects of the program. That's really where we get to differentiate and bridge the gap between all 4. We're able to see clients from being completely immobile, that they're using wheelchairs when they walk in, to be able to get them to get up and walk and get them stronger enough to be able to function back to normal levels of function. We're also able to work with professional athletes. We've literally had the gamut of the clientele that's been around between both levels of care of all these patients. Now, the expectation is to get them up and moving. We know that when we move, when we get stronger, when we're able to release certain hormones and certain feel-good hormones, we're able to pay attention more, we're able to function more, recovery is going to be significantly better. I'm so excited to be working with all the amazing group of professionals, because this kind of group for us is unique in that we get to literally work with everybody. It's a multi-dimensional approach where it's not just one program. It's not just working on your body or just working on this. We're all collaborating. When you collaborate this much, some clients are ending up sometimes working closer with one practitioner or another, but working together, we're able to bring it together and bring the whole treatment to the patient into their specific needs. With that, I'd like to turn it over to one of our wonderful family therapists, Ms. Amy Effman.
Thank you so much, Dr. Ahmed. My name is Amy Effman. I'm a postmodern systemic family therapist, a licensed in marriage and family therapy, and a master level certified addictions professional. And I absolutely love the work that we do at Orenda. As a postmodern systemic family therapist, the model that we preach to the clients is also the same type of system that we work within. We're constantly collaborating, we're solution oriented, we're speaking with one another throughout the staff and the team. And as I'm meeting with clients to initially assess doing a family genogram at time of admission, I'm constantly remaining very curious about who they perceive as their quote unquote family system. So often with this demographic, we include nannies, we might include an au pair, a sponsor, or a therapist might be a lifelong therapist. We're constantly looking to include any person that individual deems as their family member or a family-like individual. We do individual family therapy, we do couples counseling, we do family therapy, both in person, not as frequently these days, but we provide, virtual therapy sessions for the family and for couples. And also the client is constantly meeting with me and their family has full access to address any concerns they have throughout their stay by phone or by video outside of the family session. And we're lucky enough to have another family therapist on staff right now. And between the two of us, we're working with lots of really great people and supporting their families throughout the journey. And also sometimes reaching out to the people that have referred us, the clients, assuming that they see this as part of their family system, which a lot of them do. We're often in contact both with the primary therapist that they're working with at our facility and collaborating together to make sure that it's a systemic approach to therapy and their treatment. Now I'd like to turn it over to Kim Koslow.
Hi, everybody. Welcome. My name is Kim Koslow, and I work on the outreach team here at Futures. I'd like to now introduce a special video that we've created to thank all of the wonderful professionals that have worked so hard to make Orenda successful and make it what it is today. To the Orenda staff, really and truly, thank you. Thank you, Orenda staff. You have helped make this day possible. And I thank everybody for being here. We're now going to open it up for Q&A for any questions that anybody may have. So if you have a question, please use the chat button down on the reaction button and raise your hand, and we will point to you, and please ask a question. Come on, I know names.
I don't actually see a chat button. Does anybody else see a chat button?
I'm sorry, it's a reaction button. When you push the reaction button on the bottom, and then you can raise your hand, and that way we will know who it is. So Dr. Nola.
Hi, good morning, everyone. I'm Dr. Nola Bize, and I'm in Los Angeles, California, and V Solutions Consultant. I'm the CEO of V Solutions, and what we do is we do training and consulting, but from time to time, we may get a referral regarding a patient. Do you take out-of-state patients? And if so, what is the process?
I'm going to give that to Elizabeth Potts. Elizabeth.
All right, sorry guys. Yes, we absolutely admit out-of-state clients. The process for any admission would be to connect with our admissions department or a member of our outreach team and provide some basic information for us to connect with the client. We would do a brief interview with the client over the phone. And again, if the referent is involved, collect necessary medical records or anecdotal or collaborative information to be able to assess the appropriateness of that client for our program. And from there, we help assist with the arrangement of transportation and we bring them on down.
Thanks, Elizabeth. Did that help, Dr. Nola?
Yes, that certainly help. And a follow-up question, do you have any clinics out in California? Do you foresee yourself having anything out, on the West Coast?
I'm going to give that to Mike Holloway, our owner.
Happy to answer that question. We do not. We are a single facility in Tequesta, Florida, and I can't tell you what the future brings. I guess, opportunity presents itself as it does, but our sole focus is to make Futures Recovery Healthcare here in Tequesta, Florida, the best possible program for the programs we currently offer. So if anything does arise in the near future or in the future, we'll let everybody know. But right now we are focused on our 10-acre campus here in Tequesta, Florida.
Thank you.
Thank you.
And thanks, Dr. Nola. More questions? Come on, there's got to be some questions.
Kim, I just got a text message asking, are clients allowed to access their cell phones, laptops, or other technology while they are with us in the Orenda program?
Thanks, Brandon. Yes, let's give that to Dr. Ellick, Dr. Laura Ellick.
Hi, thanks so much for that question. I think it's a great question, and it's one that comes up pretty frequently. Because of the kind of clients that we admit to our facility, it can be really, really difficult for them to be able to step away from their jobs, their homes, their businesses, their childcare responsibilities for long periods of time. We definitely understand that. So as part of the individualized program that each client will get, there is an opportunity to have a business hour worked into their schedule on a daily basis. Having said that, also, we do understand that sometimes business emergencies, childcare issues do not come during that business hour. So we do allow our clients to have their cell phones, have their computers within reason. If there's some sort of cross addiction or some sort of difficulty with video addiction or an issue with porn or something of the sort, we would certainly work that into what their clinical plan is. But we are really mindful of the fact that some of these individuals really just can't disconnect for 24/7. By the same token, we do have people who come in who say, really, I want to go on a cell phone fast. I need to be able to disconnect from FOMO, from the fear of missing out. So help me to be able to do that and to learn how to focus on mindfulness instead of just checking my phone all the time. So again, it's part of the individualized programming that we do.
Thanks, Dr. Ellick. And Amy Rhodes, I see you have your hand up.
So I have more questions about clinical. I'm interested in what the clinical programming looks like, a day-to-day, Monday through Friday, Monday through Sunday. What is the clinical programming? What does it look like? What's attendance like? Do you have separate groups for individual needs? What does the individual therapy look like? How often do they get to see them? So I'd really like to know all things clinical.
Thank you very much. And it's a great question. Dr. Ellick, Dr. Laura Ellick. Dr. Ellick?
We're lagging a little bit over in this office, so I apologize. Elizabeth Potts and I will probably tag team on this particular question. When an individual admits to our facility, we are going through, the first week is an assessment process, figuring out what the best needs of the client are. In general, everybody, when they come into the facility, they are assigned a primary therapist, a family therapist, and they go through at least an EMDR evaluation for trauma. After they do the evaluation, a decision is then made whether they are going to continue with EMDR or whether EMDR is actually indicated for this particular individual. The schedule is broken down to give every client a really good balance between the physical, the emotional, and also the spiritual. So we have individual and group. So during the individual therapy, each client has a session with their individual therapist no less than 3 times per week. So that's 3 individual therapy sessions of an hour each. During the first few days of the treatment, the individual therapist and the client are working on doing a very thorough biopsychosocial assessment and setting an initial treatment plan in order to figure out what are some of the goals that you want to achieve during the time that you're here. Each client will also get 2 hours of wellness, which Dr. Ahmed sort of spoke to before, but that includes the physical needs, acupuncture. We also have IV therapy that all of the clients do on Tuesdays. Interspersed between the individual session, there are family sessions that occur 1 to 2 times per week at the discretion of the family therapist. Sometimes the families are involved, sometimes they're not. Sometimes there's a contentious divorce or people are estranged. So we work within the family system to figure out what's the best plan. Individuals have also the EMDR session at least once a week. So they're meeting with the EMDR therapist to work through any of the old trauma and to figure out triggers related to addiction. With all of this, you know, there's the focus on addiction. And of course, we have a robust offering of the 12-step groups. And Terry Mako, of course, is one of our group therapists. So if you want to speak a little bit to the group procedure and some of the groups that we have.
Yes. On Mondays and Fridays, we always have a process group. During the week, we will have a combination of process groups as well as psychoeducational groups. And as Dr. Ellick pointed out, as a primary therapist, I will meet with the individual patient 3 days a week to work on their specific issues. Initially, they'll be given an initial treatment plan. Once we've completed all of the assessments, the physical, the H&P, and the psych assessments, as a primary therapist, I'll gather all of that information, and then I will create multiple master treatment plans for each of the identified issues.
So having said that,
Thanks, Terry.
I'm sorry, in addition to some of the groups that we run that are more process-based, some of the groups that I run are more skills-based. So they're focusing on the 4 dimensions of DBT, distress tolerance, interpersonal effectiveness, mindfulness, and emotion regulation, as well as cognitive behavioral therapy. Each client will get sheets and handouts. We're putting together binders so that the clients have something that they can refer to. Oftentimes people, you know, we like free stuff, right? So everybody likes to have a binder with free stuff that they can use when they leave here. So we want to be able to give people the tools for success. So when they leave, I have a chalkboard, I have a whiteboard, so I do a lot of teaching. So I encourage everybody to bring your cell phone and take pictures of what's on the whiteboard. Use everything that we have here and bring it with you. Elizabeth,
so curious.
Yes.
I'd like to pass. Go ahead, Dr. Amy Rhodes. Go ahead.
I'm curious of the outside of the box thinking on programming. Is there art therapy? Is there music therapy? Are you offering anything like equine therapy? What's different about your programming that is going to make me want to send a client there?
Thank you, Amy. And I'm going to pass that on to Elizabeth Potts. Go ahead, Elizabeth.
Great question, Amy. Thank you, Kim. Yes, so the programming is individualized, like we said, you've heard it 1,000 times, based on the client's needs. But within that, we do offer a number of experiential therapies. We have art therapy, we have music therapy, we have equine therapy. You've heard about the skills groups that we do, the process groups that we do. We've got specialists for all kinds of different things in multiple different languages. But what makes it really special, Amy, is the way the team pulls it together. So on our treatment team meetings, we see that Ted's having a rough time and might need to do more mindfulness work. We're not only bringing in somebody who's doing maybe breath work with him, but we're also looking at our activities for that evening or for that weekend and seeing how we can deploy the vast resources to not only meet his needs, but to get group support for this individual to help him reduce that anxiety. So the skills they're learning compound with the different providers that compound with the activities that we do. So while the services that we provide, I hope most treatment centers offer, right? This is evidence-based treatment. If you're not offering it, but we're not only offering it, but the way that we're tying it all together with the wellness director, the attending physician, nursing staff, outreach, they all know what their client's doing. We all take the data from the assessments and evaluations and curate a plan for that individual. And to me, that's what's exceptional. And it's not just Amy Effman curating a plan, it's the whole team using data to drive outcomes by pulling in these amazing resources and layering in, from all of these pillars, a treatment plan like Terry referenced that is actionable and efficacious.
So when we're talking about this wellness component, is this wellness component part of, like, is there any type of adventure therapy in that wellness program?
I will address the adventure therapy piece and then toss it over to Ahmed for wellness. We do have adventure therapy. We have a separate adventure therapy program, but we see that some of our clients that are more interested in that experiential piece like to go on some of these activities. We have two different types of offsite activities. Some are, they've done a lot of work all week and they want to just relax and go to the beach on the weekend. We also have immersive activities, whether that's dining or whether that's golf, and I'll let Ahmed take it from there. But those are more focused and intentional in their curation to make sure that we are observing the clients in these realms, that they have an agenda going in and some things to think about going into these activities and then process afterwards. And I'll toss it to Ahmed to address more of those activities and how wellness is integrated.
Thank you so much.
So the way we incorporate wellness is when they get evaluated, we're evaluating them from an Eastern medicine perspective. Kind of think of an acupuncturist. We're doing a full acupuncture evaluation and whatever needs they may have from that perspective. And then we're doing a traditional Western medicine evaluation, which comes from myself, where we do a physical therapy evaluation from head to toe. We address any physical impairments or any pain that they may have, right? Some of our patients do have some chronic pain complaints or any limitations that are limiting them from completing any of their activities. Now, with regards to outside activities, we'll speak for golf just real quick. A lot of our clients have never or haven't not played in years golf sober, right? Or they haven't been able to play golf, therefore they don't feel good, and therefore they drink because they have pain. Or when they do play, they end up drinking or using opiates to address some of the pain symptoms. So not only are we preparing them to go there, right? Where beforehand we're doing whatever stretching, mobility work to address their impairments, and then addressing what's occurring with them while they're physically playing. And then the process groups that happen on Friday and Monday that Terry was alluding to get to be talked about there. So clients will come back and say, oh, that was the first time I played, a whole round sober. And oh, look at how much fun I had. I didn't know I could have this much fun doing these activities. Now, it doesn't always have to be golf. We will do kayaking, we'll do paddleboarding, whatever activities that the group or the clients actually want to do. It's, again, depending on the clients that we have on hand, but it's also within reason with the respect. If somebody is not appropriately strong or has balance deficits, we won't put them in that risk. But it's also a goal for them to go, hey, let's get stronger, let's get moving, let's do more things to help you so you can actually try some of those activities that you're having fun. And really teaching them, hey, we can have fun, we can be active, we can do activities sober again and enjoy life. There's a lot of different ways, perspectives to do it. And then bring it back to the clinical team for them to kind of take it, process it further, and go from there.
And speaking of that Eastern medicine, that holistic type of approach, how does Orenda satisfy the spirit? What does spirituality look like at Orenda?
Kim, do you want me to take the?
Go ahead, Ahmed. Yes, absolutely.
So for us, spirit means a lot of different things, whether it's religious or not, but from the perspective of the Eastern medicine and even with the Western medicine perspective, really the whole mind, body, spirit connection, teaching clients to be aware of their bodies, not only proprioceptively to know where their body moves, but just to feel what pain you have or feel certain things in your body is in itself a spiritual kind of movement or spiritual awakening for a lot of clients. So understanding what their body is one thing. And then the actual religious and spiritual aspect, I think Laura or Elizabeth probably can hit on that as well. But from that perspective, doing Tai Chi, we were just doing a Tai Chi group this morning. We're doing Qigong with our clients and breath work. A lot of our clients just have basic diaphragmatic breathing issues that they can't do. So if you're not breathing well, you're not getting enough oxygen to your body. So doing simple, basic things that way and understanding your body, really teaching you about what your body is all about and what it can do to help you make your body feel. Very important things for us.
And Dr. Ellick wanted to add a few things. I think you'd be.
Yes, definitely. I wanted to add something about that because you were talking about some of the out of the box thinking, and I think it's really important to talk about some of the creativity that our professionals have to engage in to give quality care on a daily basis. So we have clients who come in who are very, very complicated. For example, we have clients who come in who are mandated for treatment from the courts. So we're looking at clients who really don't want to be here and maybe are required to be here for 90 days. So we're looking at how can we shift somebody from an external motivation perspective where everybody from the outside is saying to them, you need to be here, but maybe they don't quite understand that they do need to be here. So part of the process is also being able to understand and work with somebody who is not quite ready to take that step for recovery, right? So a lot of the strategies that we're doing is figuring out, okay, how can we help somebody in whatever way possible, whether we're pulling from Gestalt therapy, whether we're pulling from CBT, whether we're pulling from spiritual approaches, helping somebody integrate a little bit something different into their identity, their core values, their moral structure, and their actual system of how they view themselves in the world to get them to a point where they understand that there's the internal motivation to continue the recovery process. In addition, we may have clients with significant medical complications. We have clients who have come in with TBIs, which isn't too unusual when someone has a substance abuse history to have balance issues, to fall, to hit their head. There's a lot of creativity that goes on with So one of the things that we're always looking at is somebody a visual learner? Is somebody an auditory learner? And adjusting our treatment strategy to the best way to work with the client. We have had clients who are here from the Native American tribes. That is a totally different ball of yarn right there, because we're looking at cultural differences, we're looking at spiritual differences, we're looking within the context of something that may be very foreign to us. So there's that cross-cultural competence that we have to have also when we're working with all of these other populations. We have people coming in from the Latin American population where, you know, family roles are also very different. We cannot impose our structure and our way of being in the world on somebody who comes from a very different cultural perspective. So in terms of the out of the box and the creativity, that's where all of us come together as a team and really work it based on our history, our trainings, to give everybody the fullest flavor of the program that they need for their personal recovery. So yes, it's group, it's wellness, it's mindfulness, it's neuro, but unless you look at the person within the culture and where they're actually coming from, you're losing a whole lot of information. And to me, that's what's special about our program, because we can handle all of these people who come in because we're creative and we want to do it, and we want to do it in a way that's effective and safe and comes from a place of compassion.
So I'm curious, when you speak to the Native American population, curious if you're offering AA, do you also offer any type of well-variety?
You want to adjust that?
Yes. We believe there are multiple pathways to recovery. We started out, of course, with Alcoholics Anonymous, but we support and we have internal information and meetings with Smart Recovery, Celebrate Recovery, Refuge Recovery, amongst others. And we support all of those.
The other thing is we're also very respectful of the fact that people who are coming in from Native American tribes or from other cultures have traditions and have their own treatment, their own medicine, their own structure that's very different from ours. So a client we had recently, you know, we had to accommodate, okay, you know, because of their Native American culture and their traditions, the bed that we had in the room was facing the wrong direction. So we had to figure out a way to modify that within the space of the room to make it culturally appropriate for this particular patient. This particular
medicine wheel.
Excuse me?
And of the medicine wheel. You follow the 4 directions of the
Exactly.
medicine wheel.
Yeah.
Exactly. So we're in close consultation. And that's another thing that I really like about our program. And I think that is unique is that we're working with the referrents and we're working with where people have come from, the tribe, their referral source, whatever, to make sure that we're all on the same page and not missing anything.
Yeah, I think
Thank
that's
you, Dr.
fabulous.
Ehrlich. And thank you, Amy, for kicking us off. We have 2 other people that thank you so much.
Sorry.
No, don't say you're sorry. We thank you. Ken Roberson and then Louis Ponce. Okay, Ken. And then Lena Sheffield, I see. Need to unmute yourself, Ken. There you go. Gone. Okay. Louis Ponce.
Yes, thank you. My question was answered already.
Okay,
Thank
great. Okay. Amy, you covered it. And Lena Sheffield, please.
Hi, somebody mentioned IV therapies, and I'm wondering how you use it because I'm here. First of all, I've seen it on Groupon, IV hangover therapy, and I have clients that have access to medical resources, and this IV hangover therapy thing seems to be happening quite a bit. So and I know there's pop-up little restore and IV places all over the place. How are you guys utilizing IV therapy?
Oh, that's a good question. I know there are multiple people that might answer that. Maybe Elizabeth Potts? Unmute.
All right. Not to be confused with the need for IV hydration. So that's a whole different thing, but we do offer IV therapy to our clients. It's not something that we are proposing is medically necessary. I want to qualify that. That falls under some of our more comfort services. There's a proprietary blend, so to speak, of different nutrients and vitamins that we offer to our clients during the early stages of detox and beyond that they can use to rehydrate, refurbish, and just get some of their nutritional, and that's way better for Dr. Flannery, get themselves feeling better sooner. And I can let Dr. Flannery speak to why that would be.
Great. Thank you, Elizabeth. Oftentimes, particularly in the alcoholic patient, there are significant micronutrient deficiencies that develop over time. Not only do they trade proper nutrition for the drink, but there's actually depletion at the brain level of some of these essential micronutrients. And after a period of time, this can result in deficiencies in brain and neurologic function. And so the idea is to help quickly restore and replete those missing nutrients right off the bat as we get them stabilized and ready to fully partake in the program.
Thanks, Dr. Flannery and Elizabeth. And we have a question from Family Solution Finder Learning. You need to unmute. There we go. Thank you. Up again. Unmute, please. Unmute.
There we go. Okay, I think we're good. What we do at Family Solution Finder Learning Centers, we provide treatment centers with a complete education resource, 32 learning seminars that they can provide at their location for family members in their community, as well as that are the members of the people that they may be treating at the time. I'm wondering, do you all have a family education program that extends maybe even past? See, our goal is to see the patient as a 5-year connect touch point. And there's a lot of players involved, and the only ones that really go with them are their family members. And we have a captured audience while you're treating their loved one to suggest to them, there's a lot you could do to get educated, and here's the resources to start that, of which you would be the initiator and you would then carry throughout the years with them. Are you currently doing any kind of family education, not awareness, but real education in the sense of getting an assessment, family, therapies, much more than just Narcan, but suicide prevention, harm reduction, what to do when the police show up, how to navigate drug court. These are real life issues for the families, and it kind of takes them away from being able to create an environment. Once they know how to create an environment, and we wouldn't use words like homeostasis, but we would educate them to the family does seek balance. How are you doing with that? And here are some tools.
Thank you for that question. Very good question. What is your first name, sir?
Oh, thank you for asking. Roy Poyan. I'm out of Cleveland, Ohio.
Thank you so much. And I'm going to ask Amy Effman to respond to that question. You need to unmute yourself, Amy.
Hi, Roy. My name is Amy. I'm one of the family therapists with Orenda, and I really appreciate your curiosity around the style of family therapy and the family services that we offer at Orenda. We are typically working with the client who has arrived for substance abuse or mental health or both. And at that point, the family is typically in crisis to some degree. And we are doing a lot of psychoeducation, support for the family outside of the family session with the client, and also with the client as part of the family system, as part of the family therapy. I'm certainly hearing the benefit of long-term care with the family. Can you still hear me? I certainly hear the benefit of the long-term care, but the way our program is designed at this time is that during the treatment episode, when the client is with us, the family is very much proactive in their treatment, assuming they allow us to be. And during that time, we're working with them. We might be working with their outside provider. If they've been referred by a couples counselor or family therapist, we're making contact with them. And then oftentimes what will happen is when someone transitions back to their home, whether they're living in a sober living environment or they're returning back to their old family system or immune system, as I say it, we're hopeful that the family has learned some tools and can start applying those tools. But we're also leaning on some of the family therapists that we recommend or refer for them to continue working with them. So during the time that they're with us, we're doing a lot of work with the family. The family has access to us, both myself and Dan. I don't want to say around the clock because that would be overselling the amount of time that we have, but as much time as we can offer them, we're offering them a lot of family work while they're in the program and really diving in. In terms of long-term care, a 5 or 6 month follow-up plan, at this time, that's not something that we're offering in-house. It's something that we're referring out to the providers, oftentimes are in the same location or the same area that family might be living in. So I appreciate the question. It's a great one. Yeah.
Thank you so much, Amy.
If I could, I just want to follow up with Amy. Amy, do you have like models that you're using? I mean, are you introducing them to Bowen family therapy or multidimensional family therapy? And the only reason that I say that is these are empirically proven. So in our education, we tell them to be a consumer and to drive forward into that because SAMHSA told us that's where we need to be. If we could get them into multidimensional family therapy as a model, that has the potential of reducing relapse by 65% with only 12 visits. So this is this could be for a family, a game changer.
Am I still unmuted? Fantastic, thank you. So I am a postmodern systemic family therapist. A lot of my work is influenced by solution-focused work and both narrative therapy. And I love what I do, and I've had great success with the Orenda population, applying that style of therapy with the families. In terms of long-term trackable evidence-based family work, I think that we're semi-limited to the amount of time that we have with the client while they're with us. And then what we do with the, what's really awesome about our program is that we all work together to build the aftercare plan. And oftentimes during the aftercare plan, maybe at that time, they'd be referred to someone like yourself or a family therapist that's going to be in the environment where they're living after they're with us. So we don't have everybody that stays local. And we do our best to provide as much education and support and interventions with the family. Sometimes families even ask to do, I've invited them to do writing assignments, which I call invitations, and kind of reframe their thought about their loved one and talk a little bit about what life would look like for the family system if they left, and maybe we could ask like the miracle question, or if everything looked as we would like for it to look, what would that look like and what needs to happen to get there? So I think what I'm hearing you say is, in terms of Bowen's work and all these other types of family theorists that have done fantastic work with families, we would need more time with the family. We don't have that much time. So we're semi-limited to the amount of time that we have during the treatment episode, which could be anywhere from 30 days to, let's say, 90 days, or sometimes longer, because clients really enjoy their time with us. Thank you.
Thanks so much, Amy. Okay, you guys, this has been amazing. We do have two more questions. Beverly, Shannon, Beverly, if you did, Beverly, is she still on? Yes.
I
Okay.
am.
Beverly, good old Beverly from way back when. My
Right.
good old Beverly, right? We go way back. Please ask your question and I will answer it, and then Shannon, and then we're gonna have to wrap up. You guys, we'd love to spend the day together, but we gotta wrap up. You can get in touch with any one of us, and we will answer any questions at any time. We'd love to have you come for a tour or do a virtual tour if you're not local. Whatever you need, we are here for you. The outreach team, Ray Ra. Okay, go ahead, Beverly.
Okay, so what might be the criteria that would deem a potential client inappropriate for your facility?
I'm going to go to Deja, Dr. Deja Gilbert on that.
Yes, I actually unmuted because I think the way to go about that question is to identify what is a typical patient in this program. It is a specialty program. And so I'm actually going to ask Elizabeth to pop back on one last time to close us out. The individuals who come through our Orenda program fit a certain criteria. And so what that does is it allows us to really work with a plethora. So when I look for what are the things that exclude, it's actually much less than what does the typical person look like who would be appropriate. So if you don't mind, I'm going to flip the question around and ask Elizabeth to close us out with that one.
Absolutely. I know what we started 2 years ago thinking was going to be our typical client ended up not being our typical client. We had really envisioned this to be more heavily male, a little bit older, primarily alcohol. What we have seen is our average age over the last 2 years is actually 52 years old on average. We find that people who are or were or hope to be high performing in all areas of their life, high performance parenting, high performance business, people who haven't had the opportunity yet to be high performing, but want to have that focus on how do I get there, that there is some commitment and some drive somewhere in them, whether they've lost it or whether they're just on the verge of it. We find those clients to be ones that do really, really well here. Generally professionals, sometimes retired, some people on the cusp of where they're going. And we find that when people fall really far outside of those areas, we can absolutely individualize their care and provide an exceptional clinical, medical, neuro, and restorative treatment experience. But the peer support can shift a little bit in where they're identifying with the group of individuals that they're with. Basic disqualifying factors would be significant violent criminal history. Obviously, that's going to be a safety issue for us. Somebody who is primary psych, who is actively psychotic, who is non-med compliant. So those real basic ones come. But if you have that client, call us. We can evaluate, assess, and work with this team and this kind of group of individuals we have on this call here to find appropriate placement for them. So I would always encourage when that call comes in, we don't work with adolescents, but heck, we work with a lot of really good adolescent treatment providers that we could turn you on to make that referral. I don't know if that helps, or if there was a specific question in there or a certain population you were hoping to identify if we did or didn't work with.
No, that was good. Great. Thank you.
Thanks, Beverly. Thanks, Elizabeth. And we're going to end with Sharon Erb. And go ahead, Sharon, go ahead.
Hi, I'm in Kentucky, Danville, Kentucky, out of Lexington. Hi, Elizabeth. It's been a long time. I own a company named Phoenix Management Group Services. I work with doctors who provide outpatient medication assisted treatment in the states of Tennessee, Kentucky, Virginia, West Virginia, and we're moving into Arkansas and other states. My question for you guys today is about your neurotherapy. How is neurotherapy, how do you work that with your talk therapies? And are you using scoring tools such as the GAD and the PHQ-9s?
Okay, let's see. Who do I think would be good for that? Ahmed.
So we got a couple things. So from the neuro perspective, there's a lot of neurofeedback that we're doing. That's kind of the neurophysiology, that aspect that we're coming at it, whether there's different kinds of neurofeedback, usually really thinking of kind of brain therapy. We have a group that works with us that does the different kinds of neurofeedback. On site, we have the alpha stem and the fractal work, which basically is helping for regenerating or kind of just balancing out your brain waves. As for specific testing for the neuro testing that you're speaking of, that's a little bit more advanced work that will usually be done in either a different clinical setting or a specific neuro brain institute.
Thanks, Ahmed. And we've come to the end of our hour and 6 minutes. We thank you so much for being with us. Again, in all seriousness, if you have any questions at all that were not answered, please get in touch with us. And yes, get in touch with us and we will help you. Any one of us will help you and answer any questions that you have. We appreciate you very, very much. Thank you for coming and joining and celebrating in our 2-year anniversary for Orenda.
Thank you all.
Thank you.